Good afternoon, everybody. I am Archana Reddy. I am an international board certified lactation consultant. Today, my topic is human milk banking. So today I'll be going through the process of human milk banking and how to sustain the milk donations and how to encourage mothers and what kind of measures to be taken. So these are our learning objectives today. So what is a human milk bank and why is it required? Functioning of human milk bank and how to sustain and encourage donations. So what is a human milk bank? So a human milk bank, it is a service which collects, screens, processes, stores and dispenses donor milk by doctor's prescription. These are all the process that happen within the milk bank, and once the process is done, then that milk is dispensed to the babies according to the doctor's prescription. So when do we need? I mean, which all babies will need donor human milk? So babies generally who are ELBW babies, prematurely born, or any other problems or any other issues why they are in ICU. And other issues will be like adopted babies, surrogacy, if induced lactation is not working and the mother might not have any idea about induced lactation, then donor milk is used. If a baby is in any surgery, if baby is getting any surgery and the mother is not able to produce enough milk, then we will go for donor human milk. And sometimes what will happen, mother is admitted in a hospital, different hospital, and baby is in a different hospital. So that is also why during that stage when the baby is away from the mother, we do give donor human milk. Other factors would be maternal complications, sometimes death or any other maternal illness of the mother, maternal illness of the mother, and also sometimes due to low milk production from the mother. Maybe the reasons can be improper expression, improper guidance that is given to the mother regarding human milk expression. These are few reasons why we do need donor human milk. Then like, why only donor human milk? We don't have any other choice other than donor human milk. We do have first preference will be given to mother's milk, mother's own milk. Second will be donor human milk. Then you will get pasteurized human milk. That is what we are talking about, pasteurized donor human milk. And the final call will be for, if all these three are not available, then the final call will be for the infant milk substitutes, that is formula. So why we should use the pasteurized human milk or donor human milk here? So mainly there are studies which shows that to a vulnerable infant, if donor human milk is given, then the health outcomes are much better. Like sepsis, if the risk of late onset of sepsis in a vulnerable baby or low birth weight baby is 19% in the first 28 days, and it also gives more protective effect. And necrotizing enterocolitis, this human milk, donor human milk will reduce necrotizing enterocolitis by around 79% when formula milk is avoided. ROP, again decreased ROP in premature babies because of if we give donor human milk. And feeding intolerance, is not caused by the not caused. I'm not audible. Message. Yeah. So sepsis, necrotizing enterocolitis, then retinopathy of prematurity, feeding intolerance, reduced length of stay. Reduced length of stay is early discharge, fewer hospital readmissions in the year after discharge. So once the human milk is used, donor human milk is used during the tenure of the baby in the NICU, then definitely there can be early discharge and also fewer hospital readmissions in the year after discharge. So, what about human milk banks in India? First human milk bank in India is in Asia's first human milk bank is in Sneha, that was established in 1989 in Sion Hospital, Bombay, under the leadership of Dr. Armida Fernandez. Doctor? So, Asia's first milk bank is in Sneha, established in 1989 at Sion Hospitals, Bombay, under the leadership of Dr. Amrita Fernandez. How are human milk operations done? So, human milk bank operations are generally with a, it also should contain a lactation support center, and it should be attached to a uh, hospital or a NICU, which will help them to get good donors also, and also the donor milk will be utilized in all levels. So any tertiary care hospital with a good NICU would definitely require a human milk bank. So now onwards, I am going to explain how are the operations of human milk bank happens in what is the process from the screening of the donor to the dispensing of the human milk. Yeah. So this is the entire process what actually that happens. So first happens with donor recruitment, then screening. If the screening is coming better, then only this, if the screening is passed, then milk expression, milk handling. Milk expression happens in two ways. That is, one, mother is expressing at home and transporting it to the milk bank. Then we handle the milk, we store, we also then do the process of the milk. Milk processing happens again. We do pooling, then pasteurization. Pasteurization actually, we are not doing any in India. Generally, pre-pasteurization milk screening is not happening due to other causes. I will explain you during this tenure. But post pasteurization milk screening happens, and once the milk is passed, then it will be dispensed to the recipient. If that milk is not passed, then it is disposed. So this day-to-day process, it needs to be handled very well, and it requires staff who are well trained, and we also require other support staff to do the collection, to do the like we do screening, and also we need people to help in milk expression. So there are a lot of people involved in this, and we do know, we mainly require people to encourage the mothers to donate milk. So first comes donor mother registration and screening. So for us, it starts with counseling. Most of the mothers are little apprehensive to donate milk. There are many reasons why a mother would not be willing to donate milk also. But if you counsel a mother, and if you tell the mother how her milk is going to help other babies who are vulnerable, sick, and they're not able to get their own mother's milk, definitely there will be chances that the mother would agree to do donation. So counseling plays an important role. Then getting a returned informed consent from the mother. So there will be an informed consent form where every milk bank will have all the details of the mother, birth history. Then you will also have the age of the baby, and you will have details about the family. You will have the details about whether the medications of the mother or any drugs or any the alcohol consumption history about the alcohol consumption of the mother. And finally, there is the signature or attesting of the mother saying that she is doing this donation by her own will without expecting any benefits from the milk bank. So that is very, very important to get an informed consent from the mother. Then checking the sustainability of donation. So how we check the sustainability of donation? We should check how whether the mother is feeding her own baby or not, taking history from her, how age or how old her baby is. So that gives her more understanding about whether that mother. And also physical examination of the mother, if the mother has undergone any surgeries or for breast surgeries, or she had any infections over the breast like fungal infections and all these should be done by a trained professional. That can be a lactation professional, that can be a doctor, whoever is associated with the human milk bank. Then blood samples of the mother is taken and sent uh, uh, for blood reports of HIV, HBs, AGV, DRL, and HCV. Or you can also get, if antenatally the mother has done these reports and they are not above 6 months ago, then definitely those blood reports can be considered. Then when can a lactating mother donate milk, or who can donate milk? The mother who is lactating, if she is in good health and she has enough milk, she's feeding her baby satisfactorily, and her baby is thriving, and she has excess amount of milk more than her baby, then definitely she can donate milk. And if she's not on any regular medications which can be excreted in the milk, and she should be tested negative for HIV, HBs, hepatitis B, hepatitis C, and syphilis. And she doesn't have any fungal infection near the areola region or nipple region, or any active varicella or herpes simplex infections in the areola region or mammary region, you can consider that this mother can definitely donate milk. Then what kind of expression does a mother should do? So the mother can do manual expression, mother can use a manual pump, mother can use an electric pump. It is up to a mother how she is willing to express and donate. So we can also teach her manual expression techniques to express milk. We can also give her pump if she is willing to do it in the milk bank. So milk bank should also have a pumping room, or where a mother can be able to pump, and which should give good amount of milk. So volumes of milk should be good, and this will cause less pain also to the mother when she is pumping. And it is up to the mother if she is willing to use her own pump, or if she is willing to use the milk bank's pump to donate milk. But we as a milk bank staff, we should be able to guide her about the cleaning process and cleaning schedule of her pump parts. Next comes storage, collection, and packaging of the human milk. So once the mother is pumped milk, if she is pumping at home, then she can freeze, and then she can do the freezing of the milk. And once the freezing of the milk is done, then in packets she can do the freezing, and she will be able to transport it through a proper refrigerated condition with the help of the or with the help of insulated bags, she can do the transportation if she's freezing the milk at home. If she is willing, if she is sending the milk in non-frozen form, she should be able to send the milk within 24 to 48 hours to the milk bank. There are some milk banks which arrange transportation also from the mothers on regular basis, where the bottles are given to the mother, pre-washed and pre-sterilized bottles are given to the mother. Mother will fill those bottles and keep it in the refrigerator by writing date and time of pumping, and she can send that milk to the milk bank, and milk bank people will start freezing those milk. So you can use hard plastic BPA containers, you can use sterile human milk storage bags, or a simple wide mouthed stainless steel container which is tight or screw fitting, or also very effective and cost effective also, because these are can be used for n number of times, and these are very durable, easy to autoclavable. Only problem with hard plastic containers would be mainly they are easily damaged because of freezing. Sometimes they get cracked sometimes, and screwing would be, if they are filled above little, the screwing of the cap would be very difficult. So these kind of problems we face with hard plastic. But if you use a steel container, it is durable and very, very cost effective. And breast milk, raw breast milk. Now the raw breast milk we have collected, and this should be labeled and should be refrigerated immediately. To pre-pasteurization microbial or by testing. So we have already, I have already mentioned that in India, although the international standard recommend pre-pasteurized microbial testing of the human milk, but because of the cost constraints, generally in India most of the milk banks are not following this method. So in developed countries, definitely there are milk used, at least only the smaller amount of milk is used for the pre-pasteurized testing of the human milk. In India, two things. One is because of the scarcity of donor milk, because it will waste the 10 ml of milk. We are not conducting the pre-pasteurized testing, and also one more other reason is cost constraints. Now comes pooling. Before the pasteurization, pooling of the milk is done. Pooling of the milk is done generally under a laminar airflow. Before pooling, the frozen milk is taken out, shifted from the freezer to a refrigerator overnight. And it should be used once the milk is thawed, that is overnight means around 8 hours. By these 8 hours, 8 to 9 hours, this milk is thawed and ready for pasteurization. And this thawed milk should be used for pasteurization before 24 hours. Then pulling of this milk, that you select 2 to 3 mothers or more number of mothers milk, and pool the milk under laminar airflow under aseptic conditions. And pooling is done so from multiple donors, so that the quality of the donor milk is same, and it is not pooling is not done for only for one mother's donor milk, because there can be sometimes more fore milk is collected, and there is no like more colostrum is collected sometimes. So it is always good to take multiple donors and pool that milk, so that the nutrition quality is maintained throughout that batch. Once the pooling is done, then pasteurization should happen. So once the pooling is done, then you come to the pasteurization stage. Here there are different options for pasteurization. One is Holder's pasteurization, which is 62 degrees. 0.5 for 30 minutes, and you have flash heat pasteurization, which is done for 72 degrees. So 72 degrees for rapid heating is done, but generally Holder's method pasteurization is followed in India. Most of the milk banks follow Holder's method pasteurization. So there are two types of pasteurizing machines you can see. The one is manual pasteurization method and one other one is automated. Automated pasteurizer, you have to just place the pasteurizer, the basket of milk as you see in the picture, into the pasteurizer, and it will automatically cut off when the temperature is. Water shaker bath is manual one, where you need to shift the and it is an open kind of pasteurization, and you need to shift the milk from one place to another place also. And automated, we have most and again there are a few milk banks which use water shaker baths and few milk banks which use automated. Once the pasteurization is done, then this container should be labeled with date and pasteurization cycle number to so that we will be able to take out all the batch together. So this labeling is done, then there is microbial testing. Then this milk of from this one batch of milk, 10 ml of milk is sent for testing. Again, the sample is taken in a aseptic condition, sterile conditions, and once this 48-hour sterile culture is report is given to the milk bank, then that batch of human milk, donor human milk is ready for dispensing. If there is no growth, then you will get that result. Once if there is any growth positive or any culture positive in the container of the pasteurized milk, then the whole batch is discarded. Now, after you send the milk like to the microbial testing, then this milk is frozen. This milk is frozen in around -20 degrees and will not be used till the reports, until the 48-hour sterile culture report is come. Then we will be storing it in the same container where the pasteurization is done to avoid any kind of contamination post-pasteurization. So the milk storage can happen anytime between 3 to 6 months in -20 to 25 degrees in a tight sealed container and labeled containers. Then coming to dispensing, how this milk is dispensed. First main important thing is that getting the prescription from the physician. An ICU physician will recommend how much donor milk to be given to the particular baby. Then a request is given to the human milk bank. Human milk bank will if it is in the same NICU, then they will do the thawing there. That means the milk is been brought to refrigerator temperature, that is 4 degrees Celsius, or to the room temperature, and send it to the baby and is transported to the baby side. If the human milk bank is taken to the other location other than the uh, 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 same premises, then the transportation is done under cold storage in the same pasteurized container until it is used. Then before administering the donor milk to the baby, consent to be taken from the parents about the donor milk and explaining them how the importance of donor milk to their own baby. And then donor milk is dispensed in first out basis. That means the baby, whatever the older milk is there, that should be dispensed first, and the newer milk, newer pasteurized milk should be dispensed later. Then it is always advisable to finish one pooled batch first, then only taking the next pooled batch, so that it will prevent multiple exposures. Because once the milk is been cool down to 4 degrees Celsius and transporting it, and there is again transferring it to the baby's bottles, there is multiple times, there is lot of exposure. So that's why it is better to limit the exposure. Same pooled batch is taken. Now feeding this milk. So thawing is done by keeping the container in lukewarm water or and gently shaking. There is no microwave or there is no sterilizer to be used to cool or So the milk should be never frozen back once the milk is been thawed, and it has to be used within 24 hours. So once the milk is been dispensed to the baby, definitely the time and date of the thawing should be mentioned on the container so that that can be discarded once the 24 hour. If milk is not used, that milk should be discarded. Now, what are the different types of records and documentation that needs to be maintained in a human milk bank? So there are documentation, lot of definitely there is a lot of documentation is required. So in that, mainly you should look for these are things which you should always maintain is donor registration and consent form. There is donation registers. There are dispensing registers. Yeah, pasteurization register, temperature checklists, cleaning checklists, then lab register where the results are been announced. Then you should have a requisition. If there is a requisition from a baby from the NICU, then you should have the requisition by two identification of the baby, main name of the baby or the IP number or unique UHID number of the baby. Both types of identification should be there for dispensing also. Then you have water quality checklist because RO water is used, and also timely check of the water is important. Water which is used in the operations of human milk bank. Then fridge cleaning checklist is also very, very important. These are the different checklists which are maintained in the records and documentation of to run a human milk bank. So what are the challenges generally what we face in setting up a milk bank? So main challenge is cost of machines, cost of staff, cost of space, and it is of high cost, and less availability of milk banks, less availability of donor milks are also donor mothers are also a common challenge, and less of or lack of knowledge of the mothers who are not ready to donate. And there are like healthcare professionals which are not involved in human milk banking, and they do not have any education regarding human milk banking or human milk donation. And there are some socio-cultural aspects also where some of the communities are not ready to donate due to their cultural aspects or due to their religious aspects also. And what we can do for this, how to improve donations, how to sustain the donations of a human milk bank. So first is awareness. So what we need to do to create awareness is like doing some social media post. You do some walks during the breastfeeding week, during the human milk donation day, that is around May 19th. We have something called as prematurity day. So during all these things, whenever there is something going on in the hospital, you can involve something about the human milk donation also. And also collaboration with the local NGOs or collaboration with local organizations like Lions Club, or you can also go for local NGOs which are working with small children, will also encourage in donation process. And supportive environment for donor mothers. What kind of support we should give? That ease of donation should be very, very important. They should not feel it is something they are doing a huge task while donating. Matlab, going to all so many floors, talking to so many people regarding donation, or they might not get any proper information about the donation. This is one of the hindrance generally they face. There is no proper information given to the mother how to donate, how to store, or whether somebody will come and pick up the milk, all these things. So one point contact for all this would be very, very important, which creates a supportive environment. And establishing the efficient donation system. How to establish efficient donation system is by First, identifying the mothers, whether it is your NICU mothers, whether it is your postpartum mothers, talking to them about the donation during the antenatal and postnatal visits. It can be the gynecologist, it can be the neonatologist, it can be a lactation professional, or anybody who is connected with this mother and child will help the mother to encourage. And continuous donation of the mother. If the mother starts donation, you can encourage the mother to like donate n number of times. You can call the mother, ask her about why, how she is doing, how her baby is doing, and encouraging her to donate, and giving her small token of gratitude like certificates to understand, like acknowledging her sharing, milk sharing to other babies. So that will also definitely help. And word of mouth promotion, like one mother is telling the other mother by doing social media posts, or by doing or telling to her colleagues that how she has donated her milk. All these things will definitely help in encouraging the mothers to donate milk. But the last important point is healthcare professional education, because all the healthcare professionals who are involved with both mother and baby definitely should be having an idea about how the milk bank works, and they should have how the milk donation work, what are the SOPs followed in their own milk bank if they have. So these things will help, and they should know which person they can give as a contact number to understand, to guide that mother so that she will be able to donate. So if it is a gynecologist, if it is an obstetrician or a neonatologist, pediatrician, or the support staff, or the nurses who are working in the department, or not only in NICU, I would also talk about the OTs, or we also can talk about the PICUs, because generally what happens, a baby is admitted for any surgery or something, that mother is around 2 to 3 months old mother, she's producing milk, baby is kept NPO for 2 to 3 days, and she is relieving herself by pumping and all, but she doesn't know that she can donate those milk than wasting and throwing it away. So such kind of initiatives to be taken by the hospitals where the human milk bank is running, to sensitize all the departments coming to the OT, PICU, or the wards where the pediatric babies, like below 6 months or below 1 year old babies are admitted. And to the final conclusion is, artificial formula will never give the broad range of benefits what a human milk can give. And by implementing different strategies, or the above mentioned strategies, all the hospitals and communities can significantly increase the awareness, the participation, and success of human milk donation programs. And at this high rate of preterm birth and malnutrition, definitely our country requires more human milk banks, especially in the large neonatal units or any tertiary care hospital. Definitely there is a human milk bank is required to cater the needs of the sick and preterm babies. And the references for this like topic I have taken from the national guidelines from Lactation Management Center, and also Hambana. This is the international guide. Hambana is the international guidelines for human milk banking. Thank you. So each and every drop counts, and everybody can encourage the mothers to donate milk so that we can save a lot of sick and sick newborns. Thank you.